Namaskar. I'm Imansha Agarwal. Welcome you all to the digital media platform for the India. Today we are going to discuss issues pertaining to health, especially focusing on the liver diseases in India. Due to modern lifestyle and environmental pollution, many people in India are suffering from chronic liver diseases. Today we have with us renowned doctor who has got specialization on liver diseases. I welcome Professor Dr. Ashok Chaudhury, Senior Doctor in Paras Hospital, Gurugram. Dr. Chaudhury is MBBS Gold Medalist, MD and DM Hepatology, and he's also Senior Consultant and Head Department of Hepatology, Liver Transplant and Medical Gastro, NH Institute of Liver Sciences, Gurugram, India, and Honorary Professor, Department of Gastro and Hepatology, Kalinga Institute of Medical Sciences, Bhubaneswar, former Associate Professor of Hepatology and Liver Transplant, Institute of Liver and Bioly Sciences, New Delhi. Dr. Saab, welcome to the digital platform for the India. Before we start, it is very important for our viewers to understand what liver is exactly so that they can correct better with the diseases related to liver. So, sir, please tell us about it.
So, at the first, thanks to you for giving this opportunity for a awareness to the general public. So, liver is the largest organ of the body. I know we saw the movie, we know the songs, Jigar ke bare mein, but still it is ignored. I can
Yes.
say it is the largest organ, and
Hmm.
it has around can say 100 functions. So most commonly, it is for what we eat for the digestion, for
Hmm.
what we have toxins to remove, that is detoxification, and what we need protection, that is for immunity. And then
Hmm.
most important, our bloods to flow, it needs to maintain a balance. It's neither thick or neither is thin, and that is a function of the liver. Then to balance everything, the whole body functions, it is the liver is the primary organ. So liver in nutshell is a very vital organ doing
Hmm.
coordination as well as combining all the actions to go for. So that is the functions of the livers for us.
Right, sir. Right, sir.
Then you
Okay.
rightly asked about the liver diseases. So if you go, the most common liver disease is fatty liver. Then
Hmm.
we think about this is the hepatitis related to viruses,
Hmm.
and then it is we comes to uh, having some genetic diseases, and after all these liver problems we progress to
Hmm.
develop liver cirrhosis, which is an advanced liver disease.
Hmm.
So this is liver disease in nutshell, but
Hmm.
mostly liver disease are grouped into two groups. One is
Hmm.
suddenly, that is acute conditions, and another is the chronic, that is the long
Okay.
standing. So it is acute, we call it as jaundice or hepatitis, or
Hmm.
liver failure, that is acute liver failure. What most commonly we see is the chronic liver disease, which is
Acha.
mostly uh, fatty liver, hepatitis, cirrhosis, or
Hmm.
progress to develop liver cancer. So these are the stages for a chronic liver disease, we can say.
Okay. Okay. Sir, moving on to the next question, sir, what are the symptoms of fatal liver diseases? Our viewers would definitely like to know about it.
So basically, what happens? Liver is the big organ, and
Hmm.
so people who become big, they have a more tolerance to the problems. So, the similar way, the liver
Hmm.
is mostly silent for any of the symptoms. About majority of liver disease are detected when you are going for the routine health checkup, or
Yes,
instead you
correct.
are going for something else. Suppose you have gone for appendicitis and they told that you have fatty liver. So this is the most commonly presentations. So asymptomatic, incidentally detected liver problem is the major chunk. Then
Hmm.
second important is the symptoms wise. If you go, as we call it, is the acute disease. Acute disease which happens suddenly, we get
Hmm.
loss of appetite, no interest for the food. Then we get a jaundice. Jaundice means we
Hmm.
get a redness of the urine, just
Hmm.
like cola colored urine or mustard oil like urines, and your
Hmm.
eyes get yellow. So these are the
Okay.
symptoms for a acute
Hmm.
condition when you get a liver problems. But when the disease progresses or remains silent for a long time, now progress to chronic liver disease, then we
Hmm.
mostly get symptoms related to complications of the liver function being poor, yeah, malfunction of the liver.
Okay. Hmm.
So in that case, we sometimes the most commonly we get that tummy become bloated. We call it a water in the tummy. That is ascites. Then your legs
Ach.
get swollen, so we call it as pedal edema. Then
Okay.
we develop jaundice, that is eyes become yellow in colors. And
Okay.
some people may develop blood vomiting or black color stools. So any
Hmm.
stool may become yellow. That is a normal way. Any
Hmm.
deviation from that, if it is
Hmm.
black color, it is because of the blood. If
Okay.
sometimes the liver is not working properly, jaundice is high, you may get a white color, or you can say the clay color, just like me.
Okay.
So that is clay color. So any normal deviation of the stool color is also one of the symptoms to be worried
Hmm.
for.
That needs to be taken care of.
And
Okay.
then you get sometimes forgetfulness, confusion, drowsiness,
Ach.
excessive sleeping.
Okay.
So
Hmm.
these symptoms. So these are the symptoms of
All these
liver.
symptoms can also be related. Okay. So you just mentioned about liver cirrhosis. It has become a common phenomena which is leading to cancer. So, sir, can you please elaborate about it and the treatment regarding the same?
Yeah. So liver cirrhosis, we call it as the often a end stage of the liver problem. So that means the liver is become, we call fibrosis, means liver has become dry, and then
Okay.
it is become hard like a stone, because liver is
Okay.
very soft. You have seen
Hmm.
maybe the movies or whatever. So liver
Yes.
become
Yes.
hard,
Yes.
yeah, fibrotic. So one
Hmm.
liver becomes hard, the cell
Hmm.
function become less,
Hmm.
and this is the, as the liver disease progresses, they first deposit fat, then they cause liver injury, and this injury is called as inflammation. And then when it progresses,
Okay.
they develop fibrosis. And this
Okay.
fibrosis, when it progresses, it
Hmm.
becomes cirrhosis. And
Okay.
once the cirrhosis happen, their cirrhosis has two parts. One is body is managing with the symptoms or no
Hmm.
symptom. We call it as compensated cirrhosis. That means you are not having any problem, but the disease with you, and we have to take medications and proper care.
No
But
symptoms are coming
once
up.
no symptoms, that is called as
Hmm.
compensated or asymptomatic.
Hmm.
And then
Hmm.
progress the disease, they develop
Hmm.
decompensation. What we tell, that means the liver is not able to maintain the body, because despite having liver injury, the body is adjusting. But once this is going to happen, so as we
Hmm.
discussed, all the complications like ascites, pedal edema,
Hmm.
blood vomiting,
Hmm.
black stools, altered sensorium, these
Hmm.
things happens. So that is become decompensated. So this is, we have to know, once decompensation has started, that means
Hmm.
liver is at bad, and we have to take a serious note of it. So when you diagnose to be having cirrhosis, when we have the
Hmm.
problems, so we have to know why it has happened. So
Okay.
most
We
commonly
need
in
to
India,
understand the cause for the same.
yeah, that will help in
Hmm.
the treatment definitely,
Yes.
because
Yes.
it is the cause, so we have to remove the
Hmm.
cause. So the most common cause for this liver cirrhosis problem is alcohol and
Okay.
obesity. So alcohol we take for years together, maybe 5 or 10 years, then it
Oh.
develops cirrhosis. So that's why I told you, liver is a big organ. It has a good
Hmm.
protective actions. You take repeatedly, problems is happening,
Hmm.
mild
Hmm. Hmm.
symptoms, and liver get healed. So that is why if liver is recovered,
Hmm.
or it get injured but body taken care, so you won't have symptoms. But when you
Hmm.
repeatedly harm the liver, either by alcohols or other things that will come to the liver,
Hmm.
sometimes
Hmm.
become that I will not work anymore, so then it becomes
Hmm.
solved. It develops the problems. So
Okay.
alcohol is the most common, and in fact
Hmm.
alcohol was the common before, and now it is taken care over by the fatty liver. Because previously
Okay.
people thought that alcohol, don't know the limit you have to take,
Hmm.
but
Hmm.
now
Hmm.
people are aware alcohol how much to take or not to take if you have problems.
Hmm. Awareness has increased.
Yeah. So now the
Hmm.
most common forms is the lifestyle related, that is obesity, diabetes,
Hmm.
and fatty liver. So when we have a fatty liver, we just ignore it. Then
Hmm.
when we are obese, and when
Hmm.
we have diabetes, the liver
Hmm.
has liver injury and which progress. And in fact now, in another coming 20 to 30 years, it will be going to
Hmm.
major common cause for all liver problems. So that is,
Okay.
we need to more taken care. And in fact today India, we are having one fourth of the population, 25
Oh,
to 27% is having fatty liver. Means if we are sitting here four, one may be
that's
having,
alarming.
yeah, that is a huge burden for us. But still
Hmm.
we have to think that way to take it,
Hmm.
because are the diseases where preventive is the only helpful than the treatments. So that is
Correct,
the second
correct, sir.
cause for the fatty liver,
Hmm.
that is related. Then third
Okay.
is hepatitis. Hepatitis
Hmm.
B, hepatitis C are the leading cause before independence. You can say when we are underdeveloped, but
Hmm.
with
Hmm.
developed, taken care of the treatment. So hepatitis B and C can say now third or fourth causes,
Hmm.
but still a major cause.
Hmm.
Hepatitis B predominantly. Hepatitis B is the problem in India is that it comes from mother to baby,
Hmm.
because it is not at any fault of the child. It is our fault. We have not been tested. We have not been vaccinated. The baby
Hmm.
gets hepatitis during pregnancy from mother to baby. And
Okay.
every year we are getting around 10 lakh children to having hepatitis B from mother to baby without
10
any.
lakh.
Yeah. And India have a population of 4 crores of hepatitis B. It is 3%
Okay.
of the Indian population affected. Similarly, hepatitis C is the similarly blood-borne, and it
Hmm.
most commonly goes through our needle pricks, syringes,
Hmm.
surgeries, contaminated blood products, and that
Hmm.
is around 1 crore in Indian population to have a hepatitis C related liver disease. And
Okay.
more important problem is that this liver cancer we discussed, it is most
Hmm.
often happening because of hepatitis B or hepatitis C,
Hmm.
and now obesity has taken care also because of
Ha.
fatty
Ha.
liver getting. So these two are the major causes for the liver cancer to develop. So these are the
Okay.
common causes. Then
Hmm.
next common causes for liver injury is the we call it drug induced liver injury. That means we take the medications which we don't know. We take painkillers years together. We
Hmm.
take some medications. We don't know the preparation. Someone giving us churron or something
Hmm.
like that, and we are taking this. Then sometimes we take bodybuilding
Hmm.
proteins or bodybuilding hormonal supplements. So these are the common causes of the liver injury, and that is a major jump. Around 10% of the liver failure is because of these drugs, which we don't know. We have taken a good faith, and that causes liver injury. So that is another group of patients are coming.
Our viewers need to know about this.
Definitely. And
Hmm.
then next important is another one is because of the some genetic disease or some disease running in the
Okay.
family. And once
Hmm.
anyone is having the family, we should screen for. So first treatment for chronic liver disease or cirrhosis is to search for the cause either from the history
Right.
or
Hmm.
from the investigations, and you address. If it
Hmm.
is alcohol, you have to stop alcohol. If it's hepatitis, we have to treat the with medications. If it's
Hmm.
delay because of drugs, we have to address accordingly. So that is the first treatment to know the
Right.
cause for this liver problem and to treat. Then there is some supportive medications we go
Hmm.
on with the doctor regular follow, and with
Hmm.
this, if it is acute, they may get recovery. If it is chronic,
Okay.
they remain controlled or they remain balanced. We manage complications and
Hmm.
treat them. Follow. But
Okay.
despite having all treatments, this liver cirrhosis, once they are having chronic liver disease, once
Hmm.
they have cirrhosis, they may progress. And if
Okay.
it's already progressed to decompensated phase, which we
Hmm.
called as end stage liver disease. That means liver disease has gone out to the advanced stages. So that
Hmm.
the medicines are just a supportive, but it is not going to help for the recovery. So in that
Okay.
case, we need a transplant.
Transplant. Yes. So you just mentioned about the liver transplant, sir. Can you please elaborate about it, about the liver transplant and the organ donation thing?
So transplant is a very old age concept. You know, Ganeshji, he has got his
Hmm.
head transplant.
Hmm.
So similarly, liver is to be transplanted, and liver
Hmm.
is an organ which never ages.
Hmm.
Liver can be donated from a whole liver from a organ donation. We'll talk later. At
Hmm.
any age, 8 years can be given. And liver is
Hmm.
such a beautiful organ. The story has come from the Rome, where
Hmm.
the Prometheus has given punishment that this fellow has to be thrown into the top of the hill. And a vulture comes daily, he just bites the liver because liver is tasty. So he takes out the half of the liver by his bite,
Hmm.
but when the king has come to see that this patient is or this people is surviving, why?
Hmm.
Because this culture is not acting anywhere. He's just biting, taking chunk of liver, and
Hmm.
liver grows very next day. So
Hmm.
this is the concept from where this liver has come as a regeneration. That means liver is coming up. So
Hmm.
that is how the liver transplant has concept has come up. Then
Hmm.
liver transplant means we have to replace the old one, the non-functional one, the damaged one with a new
Hmm.
one. So now the things is important here that when we think of liver transplant to be done, there is two
Hmm.
scenarios. One means we get a organ that is a liver that is received by the organ donation process. Organ
Hmm.
donation means we have a sometimes road traffic accident or any causes
Hmm.
of brain death, and the relatives are willing to donate the body. Then we take the liver, and that has been
Hmm.
used for person who is there to take it. And this
Okay.
organ donation is the ideal to be considered, but
Okay.
our bad luck is that in India,
Hmm.
this organ donation concept is still now in a rudimentary phase. We heard
Okay.
of organ donations, we know organ donations, but we don't think to do it. So through this Uday India, I will request everyone should be aware of these organ donations. There is a government
Yes.
site called as NOTTO, NOTTO, where we
Okay.
can register for every one of us for the organ donation. And this organ
Okay.
donation is purely voluntary. Even
Hmm.
if you registered as organ donor, no one is going to take away. It is,
Hmm.
if your condition happens to be brain dead, then your family has to give a consent, then it can be taken. So,
Hmm.
and second, this is a very sophisticated surgery, so that after removal of your body parts, there will be nothing visible outside.
Hmm.
So,
Hmm.
few things we need to know here. When we see a person, we just give him sympathy, but
Hmm.
we throw our organs in the fun karke bole, yeah, when we go for the burning. So rather we're not helping. So organ donation is the unmet need, and we need to change our attitude. We should register today through the Notto website. We should
Hmm.
make a chain that from me, I should spread the message to 10 people to register for the organ donations. If organ donation can be done, a single person's act of kindness will make 8 people.
Absolutely correct, sir.
So that is what the organ donation related transplant. If
Okay.
organ donation is not happening,
Hmm.
what is the common scenario in India? We go for
Hmm.
the live donor transplant. Live donor transplant means
Hmm.
someone of your relative who is
Hmm.
completely healthy, he has to
Hmm.
give a half of the liver. So when he
Okay.
gives half of the
Hmm.
liver remaining with the donor will become a
Hmm.
full liver very soon, and the half of the liver which is received by the patient of liver failure, it becomes another full liver to function. But
Okay.
here, what happens that
Hmm.
this is not a thing we should do, because you see, all Western countries and even
Hmm.
also the southern part of India, they know why a donor is a healthy person to go under the surgery or the knife. So they promote organ donation concept where a
Hmm.
dead body can be used for the organ donations. So we need
Okay.
both the things to be done. As long as our
Hmm.
system is not here to go for the transplant, we have to go by live donors where our relatives has to give. But
Hmm.
at the same time, we should promote like you through the India also. I request your editor also. He is very much active into organ donation, so we can
Hmm.
have frequent sessions to make a mass movement for the organ donation, so that the transplant should happen from a normal, not from a normal person, from a organ donation. So this is the transplant process,
Okay.
and this transplant has improved over the time. It is now around 40 years science, and with this
Okay.
the transplant has gone into very successful results. Recovery is
Hmm.
good, medications also now better, technology is better, and are now
Everything
giving
is
very good.
improving now. Hmm. Sir, next question we have is how can we prevent liver injury? It is
Yeah.
very important to be able to prevent before anything wrong happens.
Yeah. So what we told that till now we are discussing the damage control, means once the liver has
Hmm.
damage, how to go for
Huh.
that.
Then what we are supposed to do?
Yeah. But you know the prevention is better than cure. So
Obviously.
I will just want few points here. Say no
Hmm.
to alcohol. Alcohol is one of the biggest factor and the even by the
Correct.
first factor. And it is superadded by smoking. And smoking is even active or passive that adds further to the liver injury or progression of liver cirrhosis to cancer. Okay.
Okay.
Then next important is our weight. We need to control our weight. The simplest formula for your weight is your height in centimeter minus 100. Suppose if I
Hmm.
am 5 feet, that means my height is 150 centimeter. Then
That
just
is the
100
weight we
of,
should be having.
so that is the ideal weight. We should try to keep
Hmm.
it. So your
Hmm.
diet, your weight should be controlled. Your
Hmm.
alcohol and no smoking, and a daily
Hmm.
exercise. At least 30 to 45 minutes of regular exercise is going to help a lot. 10,000
Hmm.
footsteps, or you want to go
Hmm.
for aerobics, whatever may be,
Hmm.
you just engage your way. That is more
Hmm.
important. Then
Hmm.
second, what we come to next is the medications, over the counter medications. My
Hmm.
brother has taken this medicine, he got cured of this disease, so I should take this. So any
Hmm. Hmm.
medication taken without a consultation is harmful, particularly
Yes, it
painkillers.
is.
Medicines we don't know the compositions, medicines
Hmm.
which are to be taken on a regular basis for the long terms, or the
Hmm.
what we call the herbal supplements or
Hmm.
the hormonal supplements, is should
Hmm.
avoid these drugs. Then second is important to know about hepatitis status. If hepatitis,
Hmm.
everyone is compulsory to have a tested for the hepatitis, and that is most and must for all pregnant women. All pregnant women should be tested, and now every hospital and everyone make it mandatory. And if in we have not done, we have to ensure that it has been tested. That is one. Then, if
Hmm.
anyone in your family having some liver problems or jaundice or hepatitis or liver cancer, it is a
Hmm.
must for test. So, first of all, it should be generalized to be done. It's
Hmm.
like somewhere, even I have heard of some companies they have made it that if hepatitis testing has not been done, then we are not
Hmm.
going to get next year increments. So these are the types of promotions where can make it to make hepatitis testing as a compulsory. After getting
Yes.
tested, you need to be vaccinated. Hepatitis vaccine is very
Hmm.
cheap. Even all child at birth is given free doses at free. We
Hmm.
need
Hmm.
to
Hmm.
take hepatitis B vaccines. There is no age limit. If you have not taken hepatitis B vaccine, let take it. And remember, it should be three doses today, after 1 month, after 6 months. So three doses
Okay.
of complete hepatitis vaccine. All
Hmm.
should take hepatitis vaccine. All should be tested. That is a
Hmm.
must to prevent
Hmm.
hepatitis related problems. After that is important to the injections. Any
Hmm.
injection we are taking, we have to ensure that it should be a single use syringe.
Single
Syringe,
use. Yes.
yeah. And
Hmm.
second, if you're going for the tattoo or the razors in the common salons, just take care that it has been
Ha.
properly sterilized. We get infection
Yes.
from that.
This is
And
something we
second,
miss out on.
yeah, that is important.
Yes.
Then
Okay.
second important is three things: clean water,
Hmm.
clean hand, clean food.
Hmm.
So try
Yes.
to make your water. It does not need that it should be high pace system. It just
Hmm.
need to be boiled water also. That is
Hmm.
enough. So clean water. The food should be properly hygienically made. It should not
Hmm.
be contaminated. That is one. And
Hmm.
third, your hands should be clean because it is the carrier for all the infections. So hepatitis A and hepatitis E, we tell it is mostly happens from the water. Just
Hmm.
now, in Delhi, during this month of July, August, and September, there is jaundice is spreading. It is all because of hepatitis A and E, and this is happened
Yeah.
because of the water. This contaminated food,
Because of water.
street vending foods, outside
Hmm.
foods, not having clean water. So that is we need to change our attitude. And important one is that if you are having a liver disease,
Hmm.
just have a consultation with a liver doctor so that it should not go
Hmm.
beyond repair, and we should treat
Yes.
early. That should not go beyond our control.
Hmm.
And
Timely
last
consultation is very important.
yeah. And last but not least, that after the age of 40, I will request everyone not to give any
Hmm.
birthday cake or any gift. Just give a gift
Hmm.
hamper of annual health checkup. If you go for an annual health checkup every year after the 40, and if you have
Hmm.
any other problem, diabetes, obesity, alcohol, then it may be early. But routinely, if you go for a regular health checkup after the age of 40,
Hmm.
many
Hmm. Hmm.
things we can detect very early. We can
Ha.
prevent it.
Detection is possible.
Yeah. So these are the tips for the healthy liver.
Hmm.
How we can do prevent
Hmm.
this silent killer,
Hmm.
the
Hmm.
liver disease.
So we just spoke about prevention for liver injury. It is very important that our viewers know the diet for a healthy liver so that everything goes on smoothly and everybody leads a healthy life. So please tell about the diet also.
So, as rightly discussed, we are now going more towards the preventive what it should be. So we have
Hmm.
known how to take care of our liver. We should know.
Hmm.
Then next important is what we eat, that we
Hmm.
become.
Hmm. Hmm.
So
Correct.
first of all, we need to know our plate. That is called as the plate formula. That is called as the round plate formula. We should
Hmm.
divide our foods accordingly. That your diet should have the low in carb. Carb means our rice or all varieties of staple food we have in the grains as cereals. Rice
Hmm.
wheat should be, that is one. Two should be more of a proteins. So proteins may be pulses or dal based or like that. Milk proteins are
They
also
should be
good,
there in our diet.
and even non-veg is also not good, not bad. We can take
Hmm.
it. Red meat is problematic for the liver, but egg, fish, and chicken you can take, and
Hmm.
that should be in moderate amount. It is not the food, it is the most important is the vehicles, is because of the
Hmm.
spice, the oil, that have been the problematic. So we have to increase our protein content that we have discussed modified way. We have to
Hmm.
reduce our carbohydrate contents, that is two, and then
Hmm.
it's natural to reduce our fat content. Fat means
Hmm.
the oil, it should be as much as ghee or
Hmm.
butter should be limited amount. We can take as much as taste is right, not completely no, but it should be on the
Hmm.
lowest. That is one.
Limited.
Yeah. Then cooking
Hmm.
oil also, the we should prefer on the mustard oils. That is the old days. That is good for everything. And
Hmm.
second, if you're using refined oil or anything, we have to rotate
Hmm.
every month. The oil should change.
Rotate.
Not
Rotation is important. Yes.
or olive oil also is good. So this is about the food items.
Hmm.
Then
Hmm.
if you go to important next is the fiber content. We need good amount of fibers in our food. So the fiber
Okay.
content is from sprouts, salads,
Hmm. Hmm.
salads,
Hmm.
and leafy vegetables. We have to take many more sufficiently. Then next important is the antioxidant minerals and vitamins which we get from
Hmm.
the citrus fruits. You can say lemon and
Hmm.
like that we have to take.
Hmm.
But always remember, juice is not good for the liver. We should take the fruit as whole,
Fruit is
not,
more beneficial.
yeah. And
Hmm.
then dry fruits also good, particularly okra is good for the liver. And
Okay.
then next important is tea and coffee or green tea, which is now a big hit. So
Yes,
our,
it's a big time hit now.
but I'd say green tea is good, but it is not the tea. It is mostly important is the sugar. So try to have a less sugar as much as possible, and I
Hmm.
request to avoid artificial sweeteners. Let's make an habit that we should take with low sugar or no sugar. That is one.
Okay. Hmm.
And if you have a fatty liver, you are having obesity, it is black
Hmm.
coffee. There is millions of studies has now come up. If you take
Hmm.
the black coffee in moderate amount, at least 2 or 3 times, that
Hmm.
is without milk and without sugar, it helps to the liver in a big way. And
Hmm.
after this, if you come to water, that is most important also. So it is water intake should be at least 10 to 12 glasses per day. So you should make it that it is 3 to 4 liters of water intake regularly. And then important is the diet should be small and frequent.
Hmm.
That means it should be
Small
divided
and
and
frequent.
every day. So these are the good for the livers. And no is your junk foods, particularly all
Hmm.
foods, you know.
Mm, they
And
should be avoided completely.
yeah, and alcohol, as you know, and maida
Hmm.
based foods or the spicy foods, oily foods. These are very much, you can say, the enemy for the liver. So these are the small things we need in dietary. So just to
Hmm.
summarize, we need carb low, fat low, high protein, high fiber, high
Hmm.
antioxidants, sprouts and salads, along with a good amount of water, and have a habit of having black coffee at least 2 to 3.
Hmm.
That is enough for a healthy liver.
Hmm. Sir, during the discussion, alcohol has been mentioned many times. People are aware that it is bad for health, but still they end up consuming a lot of alcohol. In case they do it, what are its repercussions? Even if people know a bit about it, it's very good if you repeat it again for our viewers.
Yeah. So we know that prevention is better than cure. So we'll
Yes.
say in summary. First,
Hmm.
if we have a diabetes, if you are
Hmm.
obese, if you are taking
Hmm.
alcohol, if you have a smoking, and
Hmm.
if we have a sedentary lifestyle, it is a
Hmm.
big thing that you have to change your attitude today. One.
Yes. Change is required.
Second, you have to go for testing for your hepatitis. It is a must. After,
Hmm.
if you are having any family history, it should be definitely. Then
Yes.
next important is if you have not vaccinated for the hepatitis, you have to do it today.
Vaccination is there.
Say no to single, no to multiple use of syringes. If you're going for
Hmm.
tattoo or just please take care of that.
Yes.
And then next important is we have to see that we should not take any over-the-counter medications, unknown medications, hormonal therapies to boost your health. I think this much will cover maximum of our liver care if we know and we understand, so that healthy liver live longer. Thank you.
Thank you. Thank you so much, sir, for connecting with us. It was a really valuable interaction. All our viewers must, I think, all the questions got answered appropriately. Thank you so much, sir.